I was like, wow, this is a nice area, the hospital looks really new. And then I walked in and it was really open and it felt warm and welcoming when I walked through the door. And from the minute the first person I met was lovely all the way through.
We are a community, we're embedded in the community and we work for the community. We really are a community diagnostics centre and I really feel that the community has embraced us.
It's quite homely, it's easy to get to, it's not frightening when you walk inside the building, and the spaces have been designed to be kind of full of light and people like coming here.
We just welcome everyone with open arms and everyone's so friendly and lovely, and yeah, it's like a little family here.
So the importance of the CDC is it gives us greater capacity for diagnostics. It allows us to tell the patient what we think is wrong with them much earlier.
Hello.
How are you?
These are not private facilities. These are being provided by the NHS, for the public. My ambition is that we should get to a point where people can have the scans that they need, done quickly, done well, and get the results back with maximum convenience. We need to move some of the diagnostics out of acute hospitals into the community. It can be put in areas of great need, deprivation, much more convenient, and actually much more efficient.
The CDC at Finchley Memorial Hospital has been going for a year. It has hit 60,000 tests in many different ways in terms of cardiology, ophthalmology, ultrasound and many others.
GPs can refer patients for a whole range of tests to the CDC. For example, packages of tests that investigate a particular symptom.
They wanted to take diagnostics out of the acute units. This was to relieve the pressure within the acute units, that being the local hospitals, and also to make better patient experience.
It's definitely a very good place for patients to come. The delivery of the service is very quick. We have very modern technology for our patients.
Coming up to the CDC was much nicer than going into a hospital. I just found the whole thing a lot more relaxed around here. I couldn't believe that actually there was a car park. There was a lot less anxious and anxiety around coming in here. It was much nicer.
Just relax yourself. Hi, good morning. How are you?
We've got such good feedback from the patients that for so many of them, the main acute hospitals are really far from their home, really hard to get to. So by having this community diagnostic centre, they've been able to come and get their diagnostic appointments like on their doorstep.
Working here is great because it's less stressful. There's no emergency patients being fitted in.
I like to working here because I'm getting lots of support, and like first of all, it's like management is very good, and it's my local place as well. So it's like exactly the place I was looking for. So I'm so happy to work here.
People love coming to work, they have a great environment, they know that their clinics are going to work to time, and generally speaking, everybody loves coming to work here.
So in terms of career development here, it's exceptional. I was already working for the Royal Free Trust before I started, and I moved across for the CDC, but I went up a banding when I came over here, and then since I've been here, I've gone into management. So career development's been absolutely fantastic.
Yes.
I came from a very small trust to a massive trust such as Royal Free. And yes, definitely they do look at your progression, your personal development. They always review what's your future as well as what the patient's future.
I've never come across a place where patients really have such positive feedback. I couldn't recommend it enough.
The feedback we've got from patients is they're just so happy to come here. They want their repeat appointments to be here, and yeah, it's just fantastic.